The morning light cast long shadows across the muddy field hospital as Dr. Werner Schumann carefully packed his medical instruments. The sounds of distant artillery echoed through the valley. American forces were less than 20 kilometers away. After 3 years on the Eastern Front and 18 months in the West, the 29-year-old Oberstabsarzt knew what defeat looked like. It was April 1945. And the Third Reich was collapsing around him. "Take only what we can carry in the trucks," he instructed the nurses and medics of Sanitäter Company 217. "Priority is morphine, sulfur powder, and surgical equipment." The German Medical Corps, the Sanitätsdienst, faced a desperate situation in these final months of World War II. Once a model of battlefield efficiency, the system that had evacuated and treated countless wounded Wehrmacht soldiers was now breaking apart under the relentless Allied advance. For men like Schumann and the thousands of German medical personnel still in the field, professional duty remained even as national defeat loomed. German medical training had been rigorous and technically advanced, producing field medics capable of performing complex procedures under the most adverse conditions. The typical Sanitäter underwent 6 months of intensive training before deployment, learning everything from emergency amputations to blood transfusion techniques. By 1945, however, the German medical system reflected the broader deterioration of the Wehrmacht. Medical supplies dwindled to critical levels. Trained personnel had been steadily siphoned into combat roles as manpower shortages grew desperate. Field hospitals that once boasted state-of-the-art equipment now operated with whatever could be salvaged from abandoned facilities. "We have perhaps 3 days of morphine remaining," reported Feldwebel Ernst Gruber, the company's senior medic, as he inventoried their dwindling supplies. "The penicillin captured from the Americans is gone." The retreat westward had been a nightmare of logistics and ethics. Medical units like Sanitäter Company 217 faced impossible choices. Which patients could travel, which must be left behind with minimal care, and how to maintain medical neutrality under the Geneva Conventions while wearing the uniform of a regime the world now viewed with revulsion. Stories circulated among the medical staff about the treatment they might expect upon capture. Rumors spread that Allied forces were not distinguishing between combat troops and medical personnel, that the Red Cross brassard offered no protection anymore. Most concerning were whispers about war crimes, trials that would target anyone in German uniform, regardless of whether they had carried weapons or bandages. "They'll shoot us all," one young medic confided to his colleagues during a rare quiet moment. "My brother writes that the Americans execute SS on sight. How will they know we're just doctors?" I hope you're finding this story of medical personnel during WWII as fascinating as we find it to research. If you're enjoying this documentary, please subscribe to our channel for more untold stories from history. We'd love to know where you're watching from. Drop a comment below and let us know which part of these historical accounts resonates with you most. Now, back to those final desperate days of the German Medical Corps. The reality was more complex than the rumors suggested. Allied forces generally respected the protected status of properly identified medical personnel under the Geneva Conventions. However, in the chaos of the collapsing front, mistakes and exceptions occurred with alarming frequency. German medical units sometimes found themselves caught in artillery barrages, specifically because they occupied buildings marked with Red Cross symbols, visible targets on the battlefield. For the Sanitäter, fear mixed with exhaustion as they treated an endless stream of casualties. Combat medics had always faced danger. The mortality rate among German frontline medical personnel was staggeringly high. They crawled through machine gun fire to reach the wounded, performed emergency surgery in shell craters, and evacuated casualties under bombardment. By April 1945, the nature of their work had changed. The wounds were the same: traumatic amputations, sucking chest wounds, abdominal injuries. But the context had shifted dramatically. These medical professionals now operated in a moral twilight, treating soldiers fighting for a cause many privately acknowledged was lost and morally bankrupt. "We are doctors first, Doctor," Schumann reminded his staff during a particularly difficult night when a group of SS officers demanded priority treatment over regular Wehrmacht soldiers. "Our duty is to the wounded, not to ideology." This ethical stance would later prove critical for many German medical personnel. Their adherence to medical ethics rather than Nazi doctrine would become an important distinction during denazification proceedings. As Allied forces closed in, German field hospitals faced three options: surrender in place with their patients, attempt evacuation, or abandon the wounded and flee. Most chose the first option, though official orders often demanded the second. The third, while technically a violation of both military duty and medical ethics, became increasingly common as chaos engulfed the retreating German forces. For Sanitäts Company 217, the end came on April 15, 1945, near a small village in central Germany. American tanks appeared on the horizon as the medical staff was loading wounded onto trucks. "Doctor," Schumann ordered white flags raised and instructed all personnel to display their Red Cross armbands prominently. "We are medical personnel," he announced in halting English as American soldiers approached with weapons raised. "We have 73 wounded requiring care." The surrender process began with extreme caution on both sides. American medics immediately assessed the German wounded, while military police segregated the German medical personnel. Their immediate fate, detainment in temporary holding facilities, would be just the beginning of an unexpected journey that would challenge everything they understood about their role in the war. As they were processed into a hastily established camp, fear of revenge remained paramount. Would they face summary justice, war crimes trials, or something entirely unexpected? For the exhausted Sanitäter of the Wehrmacht, capture marked the end of one chapter and the beginning of another. What none of them could anticipate was how valuable their skills would soon become to the very forces that had defeated them. As Allied forces surged across Europe in 1945, a crisis was building behind the front lines that few historical accounts have fully examined. The medical services supporting the American advance faced unprecedented strain, managing casualties not only from combat operations, but also from the humanitarian catastrophe unfolding across liberated territories. At the 91st Evacuation Hospital near Aachen, Captain Harold Strawn described the scene in his official report. "Patient intake exceeded our planned capacity by 135%. Medical personnel have been on duty for 72-hour stretches with minimal rest periods. We are triaging based on available surgical teams rather than medical necessity." The Allied medical system had been designed with significant redundancy, but after nearly 3 years of continuous operations since North Africa, the attrition of skilled personnel had become acute. Army Medical Corps records indicate that by April 1945, surgical teams were operating at 68% of their authorized strength across the European theater. This shortage became most critical in forward surgical units, where the most complex trauma cases required immediate intervention. An American field hospital typically deployed with 4 surgical teams, each consisting of a surgeon, an assistant surgeon, an anesthesiologist, and 2 surgical technicians. These teams were designed to perform 4 major operations simultaneously, around the clock. "We were seeing 60 to 70 critical cases daily, many requiring immediate thoracic or abdominal surgery," recalled Major Elizabeth Roberts, chief nurse at the 128th Evacuation Hospital. "The surgeons were working until they literally couldn't stand anymore." The situation was further complicated by the liberation of concentration camps and discovery of millions of displaced persons, many suffering from severe malnutrition, disease, and neglect. These humanitarian cases competed for the same limited medical resources as military casualties. It was against this backdrop of medical crisis that an unorthodox solution emerged. Colonel Richard Baxter, commanding officer of the 16th Field Hospital supporting the U.S. First Army, documented the first formal use of captured German medical personnel in his official log on March 12, 1945. Have authorized the temporary assignment of 3 German medical officers to assist our surgical teams under constant guard. The decision was made under extreme necessity due to the condition of incoming wounded. This wasn't an isolated incident. As American forces advanced deeper into Germany, they frequently captured intact German medical units, complete with trained personnel. Initially, these medical prisoners were processed like other POWs, but their potential value was quickly recognized. Lieutenant Colonel James Morrison, Chief of Surgery for the 9th Armored Division, described his first encounter with captured German medical officers. Their training was evident immediately. Their field surgical techniques, particularly for traumatic amputations and penetrating chest wounds, showed considerable experience. After observing them treat German wounded, I requested permission to utilize their skills for our overwhelming caseload. The language barrier presented an immediate challenge. Captain Werner Schmidt, a captured German surgeon later assigned to the 16th Field Hospital, recalled through a translator, "I knew basic medical Latin terms, but the American surgical protocols were unfamiliar. They assigned a German-speaking nurse to translate. After the first 48 hours, we developed a workable system of hand signals and simplified commands. The American medical staff's initial skepticism was understandable. Many had treated the victims of Nazi atrocities or had lost colleagues to German fire. Trust developed slowly, case by case, as the German medics demonstrated their commitment to treating all wounded according to medical need rather than nationality. Technical Sergeant Morris Abramowitz, a surgical technician with the 16th Field Hospital, noted in his personal journal, "Watched the German doctor perform an arterial repair on one of our boys today. His technique was different but effective, used less suture material than our approach. The kid will keep his leg because of it." Udum, what began as emergency expediency in scattered forward hospitals soon developed into a more organized system. By April 1945, the U.S. Army Medical Corps had issued guidance for utilizing captured medical personnel, specifying security protocols, supervision requirements, and limitations on duties. The 16th Field Hospital became something of a test case for this unusual arrangement. Colonel Baxter documented the integration process. German medical personnel are housed separately from other prisoners, permitted to wear their medical insignia rather than standard POW markings, and are assigned to regular shifts under the supervision of our medical officers. Their performance has been exemplary, despite obvious tensions. The German medics brought valuable field experience, particularly in treating certain types of wounds more common on the Eastern Front. Their techniques for managing frostbite, traumatic amputations, and burns had been refined through necessity on the Russian front, where evacuation to rear hospitals was often impossible. Major William Harrison, a thoracic surgeon with the 128th Evacuation Hospital, observed, "Their approach to chest wounds, particularly the use of primary closure techniques, was more advanced than our standard protocol. We modified our procedures after seeing their results, likely saving dozens of additional patients." The practical realities of overwhelming casualties had temporarily suspended the divide between former enemies, creating an unexpected collaboration in surgical theaters across the collapsing Reich. The German medical officers, initially fearful of reprisals, instead found themselves valued for their expertise. Oberstabsarzt Captain Klaus Müller, who served at the 16th Field Hospital for 6 weeks, later wrote, "We expected to be shot or imprisoned under harsh conditions. Instead, I found myself operating alongside American surgeons, treating wounded from both armies. It was a strange feeling to be trusted with American lives after years of propaganda telling us they were our mortal enemies." As May 1945 approached and Germany's surrender became inevitable, this medical collaboration expanded beyond emergency surgery. German medical personnel were increasingly utilized in displaced persons camps, where their language skills and familiarity with European disease patterns proved invaluable in managing typhus outbreaks and other public health crises. The records of the 16th Field Hospital show that by war's end, 14 German doctors and 27 medical orderlies had been integrated into their operations, contributing to the treatment of over 2,000 patients. Approximately 60% American and 40% German or civilian. This pragmatic approach to medical necessity faced scrutiny during the denazification process that followed victory in Europe. Military authorities had to determine which German medical personnel had participated in war crimes or unethical medical practices, while recognizing that many had served honorably within the constraints of their situation. As Allied combat surgeons worked alongside their former German counterparts in field hospitals across the European theater, something unexpected began to happen. What had started as a pragmatic solution to a critical shortage of medical personnel gradually evolved into a relationship of professional respect. Captain James Whitmore, who supervised the medical staff at the 121st Evacuation Hospital near Aachen, noted in his April 1945 report, "The German doctors have proven themselves to be well-trained and thoroughly competent. Their surgical techniques, while sometimes differing from our own, are often equally effective and occasionally superior for certain types of wounds." This sentiment was echoed across numerous Allied medical facilities. The German approach to treating traumatic wounds, developed through years of brutal combat on the Eastern Front, incorporated techniques that American doctors had not encountered. German military surgeons had pioneered aggressive debridement protocols and specialized methods for managing blast injuries that Allied medical staff quickly recognized as valuable. Major William Harrison of the 16th Field Hospital documented in his unit's medical journal, "The German surgical teams demonstrated particular skill in managing complex extremity wounds with minimal resources. Their techniques for vascular repair and preventing gas gangrene have been adopted by several of our surgical teams with promising results." The language barrier, initially seen as an insurmountable obstacle, was gradually overcome through a combination of medical Latin, improvised sign language, and multilingual medical orderlies. German doctors, who spoke even limited English, became valuable intermediaries, translating complex surgical instructions and medical terminology. In some units, handwritten German-English medical dictionaries were compiled and shared among staff. As the immediate crisis of battle casualties subsided, German medical personnel found their roles expanding into the management of displaced persons camps. The massive humanitarian crisis unfolding across Europe in mid-1945 created an urgent need for medical care among millions of refugees, liberated prisoners, and displaced civilians. At DP Camp 91 near Frankfurt, a team of 7 German physicians worked alongside American medical officers to combat outbreaks of typhus, tuberculosis, and malnutrition. Captain Robert Stern, the American officer commanding the camp's medical services, reported, "The German doctors have proven invaluable in managing the overwhelming caseload. Their familiarity with local disease patterns and experience treating malnutrition has saved countless lives." The integration wasn't without complications. All German personnel underwent careful screening through denazification protocols, with particular scrutiny applied to physicians. Those with documented Nazi Party membership or participation in unethical practices were removed from medical duties and processed through the regular prisoner channels. However, the majority of German medical staff, particularly those who had served exclusively on the Western Front, were classified as technically necessary personnel and retained in their professional capacities. Dr. Kurt Müller, a captured German battalion surgeon who assisted at the 45th Field Hospital, later recalled, "I expected to be imprisoned, perhaps even tried as a war criminal simply for wearing the uniform. Instead, I found myself working alongside American doctors who treated me as a colleague. They were interested in my medical training and experience. It was humanizing when I had prepared myself for dehumanization." The practical necessities of this unusual collaboration led to formal policies governing the use of enemy medical personnel. In July 1945, the Supreme Headquarters Allied Expeditionary Force issued Directive 45-221, establishing guidelines for the utilization of captured enemy medical personnel in humanitarian service. The directive standardized practices that had developed organically across the theater, recognizing the valuable role these German medical professionals played in managing the post-war health crisis. These collaborative experiences significantly influenced post-war military medical practices. German techniques for wound management, particularly their conservative approach to traumatic amputations and aggressive infection control protocols, were incorporated into U.S. Army field surgical manuals. The American military medical establishment, preparing for the realities of the Cold War, recognized the value of these battle-tested approaches. For the German doctors and medics, these experiences often shaped their post-war careers. Dr. Heinrich Weber, who served 8 months at an American hospital treating displaced persons, later became a leading figure in West Germany's emerging emergency medicine system. In his 1962 memoir, he wrote, "My time working under American supervision showed me that medicine transcends national boundaries. The principles of preserving life and alleviating suffering proved more enduring than the ideologies that had driven us to war." The collaborative model established in these field hospitals created lasting connections. When American medical units withdrew from occupation duties, they often recommended their German counterparts for positions in the rebuilding German healthcare system. These professional endorsements helped many former Wehrmacht medics transition to civilian practice despite their military service. Perhaps the most significant legacy was ethical rather than technical. The decision to treat enemy medical personnel as colleagues rather than prisoners challenged the dehumanization that war inevitably produces. It recognized that behind the uniform stood individuals committed to the same fundamental mission of preserving life amid destruction. As one anonymous American surgeon wrote in his journal in August 1945, "Yesterday, my German assistant and I performed 3 consecutive abdominal surgeries together. As we worked, I realized that 6 months ago, we were patching up soldiers so they could return to killing each other. Now we work side by side to heal anyone who comes through our doors." There's a profound lesson in that, though I'm still trying to understand exactly what it is. This unlikely collaboration between former adversaries demonstrated that even in the aftermath of history's most destructive conflict, common humanity and shared professional purpose could transcend national divisions. The practical necessity that brought German medics into Allied operating rooms ultimately revealed a truth about medicine itself, that its fundamental mission remains constant, even when everything else in war changes.